Earlier this week, pharmaceutical company Allergan issued a worldwide recall for several breast implants and expanders that have been linked to a rare form of cancer. And here to talk about what we need to know about this topic is Dr. Melissa Marks, a plastic surgeon at Palm Beach Gardens Medical Center. Doctor, thank you so much for being here.
Thank you for having me.
Really scary. So tell us a little bit about these particular kind of implants that are being recalled. They're textured, you said, correct?
Correct. So the implants that are being recalled, and they voluntarily asked Allergan to recall their implants because of the texture around them.
Okay.
The texture has been associated with a very rare lymphoma called breast implant associated anaplastic large cell lymphoma. They have not linked any of these lymphoma cases to smooth implants, only the texture.
Okay, and so this has a lot of people out there thinking, oh no. One, how do I know what brand I had? What are the steps to take? What are you telling, what would you tell a patient out there perhaps had their implants done 15, 20 years ago?
Sure. So first of all, you should have gotten a card with your breast implant that tells you what type of breast implant you have and whether there is texture or not. If you're unsure, you can call your plastic surgeon, and you should also be following with your plastic surgeon on a yearly basis for physical exams. The patient should be well educated about the symptoms to look for with the lymphoma, which include asymmetry of the breast or rapid enlargement of the breast. And those are very important to look for. If you're unsure if you're having the symptoms, then you should definitely see your plastic surgeon to have them look at it.
And so they're suggesting that if people are having any kind of symptoms that they take them out, is that right?
Correct. So if you're asymptomatic, you don't have any breast enlargement, your breasts seem to be fine over the years, the FDA is not recommending removal. But if you are having symptoms, then they do recommend removal of the implants with complete capsulectomy, meaning removing the scar tissue around the implant.
Sure. And so if you're in doubt, you don't know what you're dealing with, just call your doctor's office?
Absolutely.
Is that really the best solution?
Absolutely. Every woman should be following with their plastic surgeon on at least a yearly basis for physical exams if they do have these breast implants.
As a plastic surgeon, any message out there for people thinking, oh no, now I'm scared to do something like this?
I think the most important thing is to be well educated, know what type of implants you're getting, and make sure you ask the appropriate questions at your plastic surgeon visit.
All right, very good information. Anything else you want to add here?
No, thank you.
Yeah, very good information. We appreciate it. Thank you so much. All right, for more information, of course, this is a big story nationwide. We'll be following it very closely.